Welcome to The Explainer. Today, we're unpacking a massive, hidden bottleneck right in the middle of our healthcare system. You know, leaving a hospital seems like it should be the absolute simplest part of your stay, right? I mean, you get better, your doctor signs a paper, and boom, you go home. But, as we're going to uncover today, the reality on the ground is incredibly complex, heavily delayed, and profoundly expensive.
It's a wildly frustrating paradox. You've just heard the good news. You're going home. The doctor signed off. Yet you find yourself sitting in that same hospital bed, all packed up, just waiting. 2 hours, 4 hours, sometimes even 6 hours go by. Well, we're going to shatter the illusion that a doctor's signature means a patient instantly walks out those front doors.
All right, Section 1, the discharge illusion. Okay, let's dive into this. To understand why you're stuck in that bed, we first have to look at the two completely different halves of a hospital discharge. On the clinical side, a physician has this rigorous mental checklist. First up, they need an area of disposition, meaning where exactly are you going? Home? A rehab center? Who's looking after you? Second, you've got to be medically cleared by everyone involved. Like if you had surgery, the surgeon absolutely has to agree with the attending physician that you're stable. Third, they need a solid follow-up plan so you ideally never end up back in their ER. And finally, the doctor writes up this exhaustive discharge summary detailing the whole shebang. But here's the secret. That massive mountain of medical paperwork, it's literally just the starting line.
This really illustrates the core of the problem. A hospital discharge isn't just a clinical decision, it's a massive operational execution. The clinical decision, honestly, that's the easy part. Orders written, paperwork done. But the operational side is this logistical iceberg lurking beneath the surface. Now the hospital actually has to find you a specialized ride, coordinate your medical equipment, and ensure your destination is fully ready to receive you safely.
Moving on to Section 2, the transportation bottleneck.
Let's transition to the single most common point of failure in this entire system, just getting a ride out. To put the scale of this into perspective, look at this number, 35 million. There are roughly 35 million hospital discharges happening every single year in the US. Imagine trying to coordinate a highly specific, medically safe ride for tens of millions of people while relying on outdated systems, scattered phone calls, and totally overwhelmed case managers.
And you know, the frustration goes both ways. Todd Sheridan, a VP in the medical transportation industry, perfectly captured the impossible expectations placed on these transport companies when a hospital finally calls them at the very last minute. He says, "I can't rub a genie out of a bottle. I've got 4 wheels." These companies are battling metropolitan traffic and fixed resources. Just because a hospital suddenly needs someone moved right this second doesn't mean a transport vehicle magically materializes out of thin air.
So what happens while everyone is just sitting around waiting? It costs the hospital money, like a lot of money. It costs roughly $319 an hour just to keep a medically cleared patient in a hospital bed. When throughput slows down, length of stay goes up, emergency departments start backing up, and the entire healthcare system starts choking on its own inefficiency.
Section 3, automating patient movement.
Now, what's really interesting about this is how technology is finally stepping in to solve this extremely costly puzzle. We're witnessing a massive shift. The old way literally required nurses and case managers who already have like 30 to 50 patients on their plate to flip through Rolodexes and wait on phone holds for half an hour, just blindly hoping the transport actually arrived. The new way? It integrates directly into major hospital electronic health records like Epic and Cerner. By leveraging FHIR protocols, fast healthcare interoperability resources, these systems achieve seamless, highly secure data exchange. It takes a chaotic, manual scramble and turns it into a 30-second digital booking, matching the right patient to the right vehicle, complete with live tracking. Real game changer.
And this brings us to a revolutionary concept borrowed directly from aviation, the Do Verify checklist. Back in the day, hospitals operated on a pretty flawed trust but verify model. They'd often find out hours later that a transport order was just missed entirely. Now automation brings in a pilot-style system powered by the Discharge Concierge driver app. The software actually prompts drivers to verify all patient demographics, payer forms, and transport requests instantly on their mobile devices. If anything is delayed, it immediately sets off dashboard alerts back at the hospital. So no more relying on a busy nurse's memory to check if a ride was actually dispatched. It's built right in.
The impact this has on human anxiety is absolutely massive. Ask any nurse, and they'll tell you this is the question they hear on a loop all day long. Is my ride here yet? With integrated digital tracking, a nurse doesn't have to go call a dispatch center. They just look at their screen right at the bedside and say, "Yep, they're exactly 13 minutes away." It is a huge relief for literally everyone involved.
All right, Section 4, the delivery logistics gap.
Let's see how this builds into the next huge hurdle. We figured out how to transport the patient, sure, but what about transporting their life? The healthcare transportation market is projected to skyrocket to over $30 billion by 2033. But the major transport companies, the folks driving the ambulances and wheelchair vans, are highly regulated. They are purely focused on moving the human being. They aren't picking up your groceries, they definitely aren't swinging by the pharmacy. And that creates an incredibly lucrative, massive opportunity for independent logistics contractors to fill the gap.
Because when a patient actually goes home, they need what we call a full discharge package. Discharge planners are completely overwhelmed and desperate for reliable local partners who can handle the rest of the equation. We're talking picking up pre-filled prescriptions, delivering small medical equipment like a walker or a shower chair, stocking the fridge so they don't come home to an empty house, and doing a basic home readiness check. Independent contractors using specific mobile tools, like that discharge concierge app we talked about, can execute these final crucial miles perfectly.
Look at how this compares to standard gig economy stuff. Traditional apps like DoorDash are built on pure, low-paying transactions. You're fighting over a $7 order paid for by a consumer. Discharge delivery is a totally different ballgame. It's about building a trusted relationship with hospital case managers. You aren't billing Medicare or wrestling with complex insurance. This is private pay or facility-funded support. And one full discharge package, that can command $150 to $250.
But keeping the patient safe at home faces a pretty severe headwind. We rely really heavily on home health aides to assist these transitioning patients, but that industry is frankly in crisis. Thanks to low reimbursement rates and highly inconsistent part-time hours, the home health aid industry is seeing an annual turnover rate of up to 65%. Ensuring someone's home is actually ready and supported is incredibly precarious when the workforce itself is constantly turning.
Finally, Section 5, crucial follow-up kiddo.
Which leads us to the final, absolutely critical stage of this transition. All of this logistics planning, it's designed to prevent one catastrophic outcome, the patient bouncing right back to the ER. The stakes here are incredibly high. Right now, about 18% of Medicare patients discharged from hospitals are readmitted within just 30 days. And this isn't just bad for the patient. Under the Hospital Readmissions Reduction Program, hospitals face steep, punishing financial penalties for avoidable readmissions. This transition to the home literally has to stick.
And you know one of the biggest reasons it doesn't stick? Medication. Research shows that a staggering 40% of patients over the age of 65 experience medical errors right upon release. A lot of times this happens simply because they just don't understand the complex changes made to their meds while they were in the hospital. If they don't get the right pills or take them the wrong way, they end up right back in that hospital bed.
To combat this, clinics use a highly structured, safe transition window. Day 0 is the actual discharge. Within 2 to 3 days, support staff absolutely must reach out proactively to catch any immediate red flags. And crucially, within 7 to 14 days, the patient needs an in-person follow-up appointment. This is the ultimate safety net, a chance to look at their medication bottles, reconcile the doctor's orders, and correct course before a minor mix-up turns into a major readmission.
So, what does this all mean for us? As fire protocols and driver apps speed up your hospital exit and get you out those front doors faster than ever, who are you going to rely on to make sure your life, your medications, and your home are actually ready when you pull in the driveway? It's a massive gap in our healthcare system just waiting to be solved. Thanks for joining me for this explainer. Catch you next time.